Cancer is one of the top 5 cancers in the country and the rest of the world. It causes a great deal of morbidity and mortality, especially in women. And like any other cancer, the origins of this cancer starts from the changes in the DNA or the changes in the cells within the breast tissue. And most of these changes which cause damage or which create cancer trigger the growth of the cells in a very uncontrolled manner, and that gives rise to the tumor. Percentage of these DNA changes are inherited from our ancestors, could be parents, could be grandparents, and it runs in families. It's roughly about 15 to 20% of the total breast cancer cases which are inherited. And rest of them are because of aberrant DNA changes that happen, which may not be inherited across the generations, which could be the changes having at the tissue level and which create the cells to grow in an uncontrolled manner. It is a misconception that breast cancer happens only in women. About 1%, even though it's rare, but about 1% of the total breast cancer cases are also seen in men. And one of the bad things about breast cancer in men is that most of the times breast cancer in men is very aggressive and usually detected at the advanced stages, either because of the aggressive nature of the disease or because of lack of awareness among men that it also causes breast cancer in men. The early symptoms, especially in women, could be a very simple changes. It could be a lump in the breast, or it could be a lump in the armpit. It could be certain rash-like or redness in the breast, which could be usually ignored. As one of the reasons why periodic preventive health checks need to be done, doing simple breast scans, which can be detected at an earlier stage of the disease, and it can prevent the death. It can be managed much better. There are various DNA tests done at some of the major labs, including at MedGenome, where we do certain tests which can detect the mutations in the DNA. When we detect a mutation in the tumor level, it can help the clinician to plan the treatment. Either it could be a platinum-based treatment depending on the mutation presence, or it could be a PARP inhibitor or a new class of targeted treatments that have shown increased overall survival, increased progression-free survival in the patients with breast cancer. The test can also be done only in the blood sample, which can detect those mutations which are inherited, so that you can, once you find the mutation, you can check the presence of that disease-causing mutation in your kith and kin or in the first-degree relatives who have about 25 to 50% chance of having that mutation. And if that mutation is there, they are highly predisposed to have breast cancer or sometimes even other cancers like ovarian cancer. And you can take well in advanced action. It could be as radical as a prophylactic mastectomy, or it could be increased surveillance in some of the high-risk cases to identify the disease at an early stage, so that the disease can be treated much early and better managed, rather than proceeding into the much later advanced stages, which is difficult to manage.
Subscribe to Midday India. Get direct notifications on all our videos by clicking on the bell icon.